Hello, everybody. That's Dr. Vincenzo Piccolo from Dermatology Unit of University of Campania Luigi Vanvitelli. Today, in my brief video, I will give you some useful information about some most common nail conditions. Let's start with a brief introduction about common nail diseases. I divided the condition in 4 large groups, including, first of all, infectious disease, secondarily, inflammatory disorders. The third group is represented by traumatic or self-induced disorders, and finally by tumors. Obviously, this is a minor classification just to give you some information about the 4 main groups of diseases affecting nails. Let's start from infections. Definitely the most commonly faced infection of the nail is the onychomycosis, probably an overlooked condition. This is a typical case. As you can see here, we have a yellowish discoloration of the nail with alteration of nail plate, some hyperkeratosis, subungual hyperkeratosis. Onychomycosis is due to a fungal infection of the nail plate, and it may affect all the distal part of the nail, but also the proximal part of the nail, and sometimes the total nail plate in dystrophic onychomycosis. This is a typical appearance of onychomycosis. Clinical examination here, all the distal part of the nail plate is disrupted by the infection, and the nail becomes friable, sometimes thick, like in this case, and yellowish. And on the right side of my slide, you can see also the onychoscopy, the dermatoscopy applied to the nail plate, where you can see these yellowish lines that go inside the nails together with the ruin-like appearance of the distal part of the free margin of the nail. Sometimes onychomycosis coexists together with other infections, like in this case, like tinea pedis and tinea manum. Let's see together this case. As you can see here, this patient is affected by tinea manum, tinea unguium of fingernails, together with onychomycosis of toenails. Let's go through acute paronychia. Is commonly seen in children because sometimes they suck their fingers or they play with their cuticles, and it can happen that there is a sudden painful edema of the periungual tissue, like in this case, draining pus or blood in some case. And this is the typical phase of the so-called perionesis or acute paronychia. This is a typical bacterial infection due to Streptococcus or Staphylococcus aureus. In chronic paronychia, we see some nail alteration, like these so-called bew lines and transverse nail dystrophy, that are secondary to the chronic inflammation of the periungual tissue. Like in this case, this condition is often due to a combination of factors such as candida infection of the periungual tissue, but also a chronic eczema of the fingernail. For instance, people who use so much their hand in their work, or after washing and washing again, compulsive washing of the hands. This is a detail of the patient that we saw before. Look at the nail plate alteration that are secondary to the inflammation of the periungual tissue. Look here, there is some onychomadesis, a proximal fracture of the nail plate, and here the bew lines and the alteration of the nail plate. Look at these erosions here and some scaling of the end, indicating a disease, a chronic disease of the end. The green nail syndrome is another quite common infection of the nail, in this case of the toenail, secondary to the Pseudomonas aeruginosa nail infection. Pseudomonas aeruginosa does not affect only immunocompromised patients, but also immunocompetent. When there is a primary disorder of the nail or after trauma or in nail psoriasis is more common and is typically and easily diagnosed due to this green discoloration of the nail plate that is secondary to the production of piocyanin, that is a pigment that is produced by Pseudomonas aeruginosa in the nail. So please keep in mind this picture because it's very common for aeruginosa, Pseudomonas aeruginosa. And finally, as a representative of viral infection of the nail, I'm going to show you some cases of viral warts secondary to HPV infection. Here, the typical appearance of subungual wart and the dermatoscopy of wart showing this. You see a punctate hemorrhage and all these hyperkeratosis surrounding these dotted vessels, pinpoint vessels seen at dermatoscopy. And this is a case of periungual wart showing the same dermatoscopy. So pinpoint thrombosed vessels surrounded by this whitish halo and hyperkeratosis. Let's go on with inflammatory disorders. And first of all, the most important inflammatory disorder of the nails is nail psoriasis. Nail psoriasis, different signs can be seen. And I choose this picture because this patient presented with all the signs of nail psoriasis. First of all, the onycholysis, the detachment of the nail from the nail plate, some nail pitting, it is punctate depression of the nail plate, some subungual hyperkeratosis, and these pinkish salmon-like areas that are typical of nail psoriasis. This is another detail of the patient. You see onycholysis at all the fingernails, some hyperkeratosis, and the pitting is well seen in this patient. It's very important to recognize nail psoriasis because sometimes patients' presentation is characterized just by nail sign psoriasis. So it's very important for patients with arthritis to distinguish psoriasis, for instance, or where you are in doubts for a differential diagnosis with different condition, recognition of nail psoriasis could be very useful to make a prompt and correct diagnosis. This is a less common disease, just a nail lichen planus, but I'm going to present you just for differential with nail psoriasis. Like you can see here, onycholysis is missing, and the most important finding is this longitudinal alteration of the nail associated with a fracture of the nail. So the longitudinal ridging along with distraction of the nail plate are probably the most common finding of the lichen planus. And in most severe case, we can see the pterygium, so the extension of this ridging to the periungual tissue, like you can see here in this patient at the first fingernail. Trichonychia is another quite common condition of the nail. Patient typically present with these round nails with a scent-like appearance. The pathogenesis of trichonychia is not perfectly understood, but it may be secondary to nail psoriasis, to lichen planus, but also to alopecia areata. Sometimes patients with alopecia areata can present with this finding. When it affects all the fingernails and the toenails, it identifies a condition that is called 20 nail disease. So a disease of the nail affecting all the nails. This is another picture of trichonychia. And in the latest years, we are observing more and more cases of this condition that looks like psoriasis, but it's acute, is associated with itch and periungual alteration, characterized by onycholysis, splinter hemorrhage, and sometimes also subungual hyperkeratosis. This is a typical appearance of artificial nails, allergic reaction secondary to acrylates that are inside artificial nails. Patch test then can confirm this condition. The third group of disease is characterized by the traumatic and self-induced disorder of the nails. In this case, the trichonychia that we saw before is secondary to nail biting. It's very common in children or in after psychosocial stress. Like you can see here, we see an enlarged lunula and an alteration of the nail plate characterized also by the koilonychia. This condition can be secondary to compulsive nail biting. Also, this condition can be inserted in the group of traumatic disease. Is very common, the onychocryptosis or the ingrown nail. In this case, is secondary to an alteration of the nail profile that is called pincer nail. This hypercurvature of the nail plate is responsible for the development of inflammation, sometimes also infection of the tissue, periungual tissue, and secondary to the periungual granuloma, like you can see here, because of the, ingrown nail in this patient. Another self-induced condition is called median canaliform nail dystrophy. This condition is secondary to this compulsive movement, self-induced by the patient, in which the self-manipulation of periungual tissue provokes the appearance of multiple nail alteration, like in this case, like view lines of the nail, mostly affecting the median area of the nail plates bilaterally. This condition that is very common but is important to recognize is called subungual hemorrhage, just blood that is inside the nail after micro or big trauma of the toenail. In this case, like you can see here, in this case is associated with orange chromonychia, often secondary to trauma through chronic microtrauma of the nail. Here we can see this bilateral subungual hemorrhage in this patient, probably due to wearing some very unpleasant shoes that could provoke this condition, or after long walking and things like that. This is another case with correspondent onychoscopy characterized by the presence of this large blood accumulation, often seen in the medial part of the nail plate. And finally, the tumors. Tumors represent a very large group of condition of the nail, but here I'm going to show you some pictures of the most common ones. First of all, the onychopapilloma, that is characterized by the presence of this thin erythronychia of the nail associated with some hemorrhage and a very small subungual hyperkeratosis. This is a benign tumor of the nail matrix here, and its proliferation can provoke the alteration of the nail plate, like in this case. The onychomatricoma is another benign tumor of the nail matrix characterized by this alteration, this tent-like wart-like alteration and this typical tubular appearance at dermatoscopy of the free nail edge that looks like tubular, like in this patient. This is a subungual exostosis in a child. That is a neosteochondral proliferation of the distal phalanx of the toenail, in this case, that upwards the nail plate, provoking pain in patients, and is a progressive disease, and it should be confirmed by X-ray, like in this patient, and surgically removed, even if it is a subungual exostosis. In this case, we have a Cannon tumor, i.e. periungual fibrous tumor of the periungual area that is often seen in patients affected by tuberous sclerosis complex, and it belongs to the diagnostic criteria of this syndrome. This is a case of glomus tumor, another benign but very painful tumor of the nail, characterized by this large erythronychia and this swelling of periungual tissue with the violaceous purplish discoloration of the nail. Let's go on with some cases of nail pigmentation, the so-called melanonychia. Melanonychia includes a large group of differentials, including inflammatory disorder, post-inflammatory traumatic melanonychia, and nevus, like in this case. We don't have time to discuss about dermatoscopy and melanonychia, but this is a nevus because it's small and quite regular at dermatoscopy. Sometimes congenital nevus can present with these more, atypical features resembling melanoma, but history of long-standing lesions appearing before 5 years of age suggests the diagnosis of congenital nevus. And here we have some cases of melanoma, acquired pigmentation, this black pigmentation of the nail plate that resemble a subungual hematoma in this case, with some pigmentation, the so-called of the periungual tissue, the so-called Hutchinson sign, and in this case, the irregularity of the band that is more than 6 millimeters and is characterized by irregular bands for color, for thickness, and Hutchinson sign associated are all typical of nail plate melanoma, like in these patients. Look at this other case. The bands are different for thickness, for color, and for characteristics. So it's very important to recognize melanoma that in this case is associated with a typical acral lentiginous melanoma. And sometimes we have alteration of the nail plate with ulceration of the nail plate that is secondary to a melanotic melanoma that is very difficult to diagnose because of absence of pigmentation, like in this patient. A melanotic tumor also includes keratinocyte tumor, such as squamous cell carcinoma, that is characterized at onychoscopy by presence of this ulceration together with atypical and irregular vessels. And finally, we have the Bowen disease, such as the squamous cell carcinoma in situ, that is characterized at dermatoscopy by this wart-like appearance associated with the alteration of the nail plate and nail pigmentation that is commonly seen in Bowen's disease. And for today is all. Thanks for listening.